to adrenal burnout. Adrenal burnout and exhaustion render you defenseless against continuous chemical, emotional, and physical damage that occurs with chronic stress. But traditional medicine doesn't really believe in something called adrenal fatigue. They believe in something called Addison's disease, which is a disorder that occurs when your body produces an insufficient amount of cortisol and aldosterone. It's a deficiency that happens because of the actual destruction of the adrenal glands, and it's a permanent disease. Usually occurs when a cancer or an infection like tuberculosis invades or destroys the glands. So when your adrenals are so fatigued because of long-term stress, such as chronic pain, if you suffer a temporary insufficiency, this is harder to diagnose. And these stressed out adrenals may enlarge slightly, but they really don't look any different than imaged when they're imaged. So it doesn't catch anybody's attention, and they usually produce normal blood levels of cortisol. So there are special functional medicine tests that you can do that look at saliva accurately to determine and uncover any problems associated with adrenal fatigue. So let me explain a little bit more about those tests. Weak adrenals can supply adequate cortisol levels when the body suffers a little stress, but when you expose the person to major stressors, or if somebody has post-traumatic stress disorder, the adrenals often flunk their challenge because they have no reserves. They've got no gas left in their tank, and that's why saliva tests do better than blood, and that's the special test I do. I actually test your saliva at 4 different times during the course of the night to determine your levels within a 24-hour period. See, your adrenals produce a wide variety of hormones essential for everyday life. And acute or chronic long-term stresses can compromise your adrenals and lead them to a condition called adrenal fatigue. So what are some of the symptoms associated with adrenal fatigue? Well, adrenal fatigue is known to cause hypoglycemia, hypotension, neural-mediated hypotension, which is like dizzy when you go to stand up, fatigue, nauseousness. If you're nauseous upon waking, when you feel better when you skip breakfast and then you crash later that morning, often those with adrenal fatigue will crave salt. It can cause vomiting, constipation, abdominal pain. This is seen a lot with abdominal migraines in kids. The abdominal pain is a huge issue with adrenal fatigue. Diarrhea, muscle or joint pain, hyperpigmentation, which is an excess of skin color changes. You can actually lose some of your scalp hair, excess facial hair or body hair, but that's really seen in men only. The vitiligo, which is changes in skin color, auricular calcifications, where those little, calcium deposits in the earlobe, you can actually get gastrointestinal disturbances, GI disturbances, decreased mental acuity, such as, what we call brain fog, normal body temperatures, which can also be a sign of a low thyroid, decreased metabolism, a compromised immune system, and a decreased sense of well-being. So adrenal fatigue tends to look a lot like a low thyroid. And while thyroid is a huge issue with migraine patients, it's totally a topic for another teleconference. But it's just not always the thyroid. Your thyroid and adrenals have to work hand in hand. So if you treat only your thyroid and you don't treat your adrenals, you're not going to get very far. So you're going to start to feel better, you're going to crash, and then you're going to wonder why. General adaptation syndrome is something that we refer to when we talk about something called fight or flight. You've heard of that, right? Well, what we're really talking about is the first stage of general adaptation syndrome, or the gas phases. So the gas phases can be broken down into 3 categories. The first is what I just mentioned, the fight or flight. And this is when you originally go into alarm mode. Your body goes ahead and tells the pituitary and the adrenal glands start releasing stress hormones. And the hormones that they release are cortisol, adrenaline, norepinephrine, dopamine, and a couple others. But fight or flight tells your body to be on red alert. Your heart beats a little faster, your blood gets to the brain and the muscles a little faster. Basically, digestion stops, and all other functions that aren't essential for the fight or flight also stop. So then you have stage 2, and this is your resistance reaction. Alarm reactions are usually short-lived, but resistance reactions, well, they can hang around for a while. So cortisol is your key hormone here, and cortisol is secreted by your adrenal glands. Cortisol helps cellular energy. It's actually a potent anti-inflammatory, and the resistance reaction of the gas phase allows your body to endure ongoing stress, whether that's pain, fatigue, injury, and it helps you do this for longer periods of time. DHEA, along with other corticosteroids, they convert fatty acids, carbohydrates, proteins. It converts these into energy, and your hormones increase their salt retention, and therefore they increase your blood pressure when they need. They also help regulate your blood sugar. So now that you know this, doesn't it make a little sense that when you have adrenal fatigue, you suffer from low blood pressure and your sugar in your blood test will likely come in high? It's not the sugar that's the problem, it's the adrenal fatigue. So then the third stage of the general adaptation syndrome is exhaustion. And this is the result of chronic oversecretion of cortisol. This leads you right down to the road of adrenal exhaustion. And adrenal exhaustion leads you on a downward spiral towards poor health. Chronic headaches, dizziness, nausea, migraines, allergies, allodynia, which is pain all over to the point where to touch somebody is extraordinarily painful. My gosh, even your hair on your head can hurt. Fatigue, dizziness, depression, low sex drive, chronic illness, cold hands, cold feet. These are just some of the symptoms associated with exhausted adrenals. The majority of patients I see for chronic illnesses such as migraines, fibromyalgia, and chronic fatigue syndrome, they're all suffering from adrenal exhaustion. If they weren't, they wouldn't have any of those symptoms. But they have literally burned up their stress coping mechanisms, the adrenal glands. So between the many years of poor sleep, poor diet, unrelenting pain and fatigue, excessive stimulants, and relying on a myriad of prescription meds, the adrenals and the chemicals they release, they're toast. They've been used up, they don't produce anymore. And once adrenal exhaustion sets in, it's not long before the body begins to break down. Getting stressed out and staying stressed out is absolutely the beginning for chronic illness for most, if not all, patients with unshakable illnesses have this problem.